G'day everyone. What's new at Attune? We wanted to share some of the new things that are happening here, which we're very excited about. And today we've got Dr. Gillian Evans. How are you, Gillian?
I'm fine. Very excited to be working here.
Yeah, thank you. We're very excited to have you as well. So Gillian is a GP that is going to start with us next week. So we're really excited to be able to share a little bit about what Gillian's going to be doing, because it's a little bit unique in terms of the GP space. So firstly, Gillian, can you explain a little bit of your experience as a GP?
Well, starting at the beginning, I went to local university at Newcastle, graduated in 2086, spent 5 years in the hospitals, then became a GP, then went to the public system and gained lots of subspecialty skills and chronic diseases, especially diabetes, the sort that baby boomers get in their complex lives. Disabilities and palliative care, death and dying with dignity and living your best life you can. The things that led me to this, I guess you'll be interested in that too, Simon.
Yeah, well, firstly, so you're going to specialise as a baby boomer GP.
Yes,
so can you explain what that means?
Well, I'm a baby boomer too. It comes out quickly, doesn't it? The things that, that have led us to be where we are and the sort of people we are by the time we get to our age. And we've got complex lives, let's face it. We've got ageing parents, we've got kids, we've got grandkids, we've got jobs. If we're lucky, we've got jobs. And all of us come through with a certain amount of emotional baggage in our lives. And I have particular interest in mental well-being, helping people cope with that, and I guess my approach, the things that make me a bit different, I really like to listen well. That's one of my superpowers. People often say that, my girlfriends say, well, people open up to me, tell me their whole life story, in the supermarket, in the bus stop. And I'm a bit of a Sherlock Holmes, I really like to get to the bottom of things. And being a baby boomer, as I said, our lives are complex, our health is complex, and maintaining some well-being can be really complex as well.
And I think that's the key thing, is that baby boomers' lives are complex. So to have someone who can specialise that, and here at Attune we have a standard half an hour consult, so you do get that extra time to be able to dig in and to be a bit of a Sherlock Holmes and actually delve through some of those situations that are happening. And I think that's going to be really important to really help some of those people that have these conditions.
Yes. And I think part of that is I really value the team approach here. Couldn't do it all by myself. I love the fact that I've got a dream come true, working in a place with lots of integrated staff, an integrated approach, and I think that's just what baby boomers need.
I agree, and I mean, having that whole team at your fingertips, physios, osteos, nutritionalists, it just means that that whole care can be provided, and there's also a continuity of that care, isn't there?
Oh, continuity is the best strength of general practice, and working with a team to add to that continuity, it's fantastic.
Awesome, awesome. And so what other special areas of interest do you have?
Well, I have a particular interest in neuroscience and meditation, stress management, mindfulness, chronic disease, lifestyle medicine. And you might be thinking, how do I end up with those subspecialties? And I think it's because I was given the opportunity when I was 28. I had a stroke, and you think, how's that an opportunity? Well, in 1989, there wasn't the word neuroplasticity in the medical dictionary. So I followed my intuition as to how to get better, and that led me down that path. And all those skills that I acquire, I put into practice, and it's led me to become the sort of doctor I am today. And so I use those modalities to put together the jigsaw of why we find ourselves in the situation we're in. And I guess the baby boom and mental health is a big issue, how to regain your well-being in mental health, and how all the biological illnesses and the social aspects of our lives, our families, our work, all those things, and also the spiritual. You know, that's really important too. And so I try to make sense of that jigsaw and frame it in a big picture so that we know an approach and a plan. And all that takes time to make sense of those things and to make a action plan for us both to follow. And here at Attune, I am so blessed. I've got a whole half hour minimum to begin to work with you and understand you, and that's fantastic. Because, you know, the slow food movement is much better than the fast food movement, and same with medicine. Slow medicine is the way to go, not fast medicine.
Oh, I totally agree. I love it. I love it. And you're just going to fit in so beautifully here, Gillian. So thank you so much for your time. Look, if you've found that very interesting, or you're looking for someone to give you some more support around some of the conditions you have, we would love to help you out here at Attune. So give Gillian a call. Thanks so much for tuning in. We'll see you next time. Thanks so much. Thank you, Gillian.
Look forward to meeting you. Bye.